Dealing with fat buildup is the first side of the question of weight extremes. The other side concerns the problems of being thin. What happens when the body's fat reserves get used up? Some mammals lose vast amounts of weight every year. Humpbacked whales migrate all the way from Alaska to Hawaii to calve and then go north again. The adults manage the entire 4-month period without eating. On the whole spectacular journey, they may occasionally swim through their usual food, crustaceans called krill, but they don't eat until they're back in Alaskan waters. Here they spend the summer months converting crustacean calories into fat. Females especially have to eat tremendous amounts to make up for having lost up to 10 tons in calving and nursing their young. Not wasting time or energy in food gathering seems to be the most efficient way to exploit warm southern waters for calving, as well as productive northern areas for feeding. With emperor penguins, it's the males that grow thin in the breeding season. They spend 2 months in minus 60-degree weather, incubating their mates' eggs without taking any food at all. By the time the females have come back from fishing forays and start feeding the newly hatched young, the males have lost up to 40% of their body weight. The mating game is hard on many males. Bull seals spend most of the rutting season defending their harems. They don't take time to eat. And it's the same for bighorn rams. The rut is a series of ritual battles. Eating is postponed, even when the battleground itself offers grazing. Mammals with small bodies make up for rapid heat losses with a high metabolic rate. But hibernating species conserve energy with a low winter metabolism that barely sustains life. That way they can live on fat stored during a summer and fall of overeating, and make their bodily reserves last all winter. Famine lowers immunity to infection, slows down growth, and may produce small-bodied adults. The young are most vulnerable to the dangers of drastic shortages. The fat reserves in their slight bodies are low to begin with. But what's the effect of malnutrition on mental development? University of Toronto nutritionist George Beaton.
It's known, for example, in experimental animals, that if you impose a severe restriction of food, the number of cells in the brain will be reduced, as they will not increase the way they normally should. It's also known that if those increases in cell number do not occur at the phase of growth that they should, they cannot recover. The cells can grow in size, but not in number at a later stage. So it is clear in the animal and in the human that brain size can be affected by severe malnutrition or by severe infection. What is not clear is whether brain size really affects brain function.
What does affect brain function is the development of brain cell pathways, of learning, and that depends on active interaction with the environment. But in a chronic food shortage, most people try to conserve their energy.
One of the responses to malnutrition is a decreased activity, as becoming withdrawn from the environment. And the feeling at the moment is that that phenomena, the withdrawal of the child, makes worse this question of the interaction of the child and the environment, and probably has its effect on the development of functional pathways, albeit not necessarily development of the brain as an organ.
If there aren't enough calories coming in to form the body's everyday fuel, glucose, fat reserves are used to produce an emergency fuel called ketone bodies, which can suppress hunger pangs. The last defense against death by starvation is protein breakdown, giving a final measure of glucose, vital to the brain, when the body starts feeding on its own muscle tissue. Angus Barbieri spent just over a year without eating anything. He lost 2/3 of his almost 500 pounds, living on his fat reserves. At Toronto's Sick Children's Hospital, Stanley Zlotkin.
The length of period without eating really depends on what the person has to start with. If you take a tremendously obese person who has very plentiful fat stores, that person could last for months and theoretically even years on his fat supply, if in fact they were large enough. If you take a lean individual, this person would only be able to last for possibly as long as 60 to 80 days, and certainly no longer. The important aspect is that we must preserve, or man tries to preserve, the protein within his body. And once about 50% of this protein is used up, man no longer has the strength to keep on breathing, and death ensues very soon after.
Mahatma Gandhi used self-imposed starvation as a political device in the 30s and 40s, when he was trying to draw the world's attention to India's plea for independence. Gandhi always broke his fasts in time, and in the end, they achieved their purpose. There's been a modern parallel in Belfast with imprisoned IRA members. Ray McCartney, a convicted murderer, fasted for over 50 days.
We and my 6 comrades are prepared to go through this, and we are prepared to die to prove that we are special prisoners and our 5 basic demands are just.
In 1920, Terence McSwiney was the revolutionary mayor of Cork. He went on a hunger strike in a British prison, and after 74 days, he died. IRA starvation symptoms hit the headlines: partial blindness and nerve disorders caused by vitamin deficiencies, encroaching weakness as protein is used up, and then when the brain is starving for glucose, a final coma. McCartney gave up his fast, but since then, 10 IRA protesters wasted away and died. Deliberate overeating keeps these men fat. The sumo wrestlers of Japan. Huge meals keep up their fighting weight. Bodily ideals vary with different motives from place to place, through history, and by gender. With most men, weight and shape are usually the products of muscle development, but not with most women.
The female has a larger percentage of her body weight as fat compared to the male, and there may be a couple of reasons that would explain this. The first is there may be an aesthetic aspect of increased fat in the female over the male. It's difficult to give any definite scientific feeling about this aspect. A second possibility is that during the pregnancy, the female gains somewhere around 12 or 13 kilos, or around 25 pounds. Of this weight, only about 50% is the weight of the fetus and the amniotic sac and fluid. A good 2 to 3 kilograms of this weight gain during pregnancy is additional fat stores that the maternal organism takes on during this 9-month period.
The production of mother's milk uses up some of the fat reserves. The rest may be needed to sustain a new mother while she is recovering her usual energy and activity, especially if, for any reason, there's a food shortage. The tendency for the female body to be padded with fat has drawn attention in many ways. Primitive cultures often saw it as a symbol of fertility, the Earth Mother's ample curves. Medieval fashions favored delicate virginal shapes, and medieval diets produced smaller statures than those seen today. While the figure fluctuated, diets improved. By Renoir's time, the full figure had made a robust comeback. And in this century, vogues have ranged from the almost boyish bodies of the 20s and 30s through various shapes designed to catch the masculine eye, to the lean, more athletic form of today's liberated woman. But still, there are pressures that deny the bodily shape provided by evolution. There are disciplines that dictate a loss of female fat. As a dancer, Caitlin Maggs must be particularly aware of her own body and of the special needs imposed by her profession.
Aesthetically, female flesh isn't in. It's not acceptable, and so everyone's dieting to keep it off. And it's hard to maintain it because basically you're maintaining an underweight. And as soon as you eat normally, the weight goes on instantly because your body is saying, I want to be heavier, you know, I want to be a woman. It's a struggle, and I mean, some of my friends, it became a real, psychological thing, you know, it really, I think, affected them in that they were really unhappy because they didn't feel what they were was good, you know, like it was bad the way they looked, and yet that was them. I had one really close friend in England who was just a little bit, maybe a touch sort of too much shape, but a beautiful dancer, and she started dieting, and usually you notice it when it suddenly becomes an obsession and the person just is getting thinner and thinner and is really into the whole thing. And she got extremely ill, and it got to the point where the school, you know, sent her home, and she couldn't come back for 2 months until she put on weight because she was just really ill, and then they discovered that she had anorexia.
That's what Julie has, anorexia nervosa, which means loss of appetite. But those who suffer it, although they refuse to eat, are always hungry. What causes this obsession? Social worker Libby Ridgely.
One attributes the enormous influence of fashion and its emphasis on being thin. Movies, magazines, particularly television, drums into you on a regular basis that one can be loved and respected by being slender.
Janet Pollovy of the Clark Institute of Psychiatry, Toronto.
It used to be that females were expected to be just super housewives and super mothers. Now they're expected to be super housewives, super mothers, and super efficient businesswomen all at the same time. I think that a lot of teenage girls, when confronted with this kind of expectation, are a bit overwhelmed and just sort of back off from it a bit and say, I'd rather not grow up just yet and have to be all those things. I don't really know who I am or what I want to be yet. And one way of backing off is to change your shape back into the shape of childhood. There are a lot of reasons. Other reasons would include avoidance of sexuality. And also, I think most of all, it's a cry for help. It's a way of saying, there's something wrong with me. Look at me. Please, help me.
Because I don't feel my life has any direction right now, and I don't know exactly where I'm going. And
you mean with your career? Or?
Yeah. And until I'm sure of myself and know what I want, I'm afraid to let go of it.
Of the anorexia?
Yeah.
How does the anorexia become sort of a protection, a coat of armor? That's sort of what you're using it for, right?
It's a way of control.
Controlling what?
Your life, I guess.
That's
Your body.
It's a way, certainly, of controlling your body.
Yeah.
It's not a way of controlling your life, unless you want to spend the rest of your life involved with hospitals and psychiatrists.
No, I don't intend to.
I was concerned.
The treatment of anorexia is a long and complicated process. Dr. Ronald Liebman of the Philadelphia Child Guidance Clinic is a pioneer of family therapy. Sessions involve Julie's immediate family to encourage them all to work out just what pressures Julie is responding to by eating barely enough to stay alive.
Was your husband involved in that at that time?
Her weight loss at one point was so drastic she had to be hospitalized. It may have saved her life.
And
What was your weight before this all started, approximately?
the peak was about 97.
97?
Yeah.
How tall are you?
5'2".
What do you weigh
They
now?
hold me. That I don't discuss in front of my family.
Well, could you just
what
whisper
was the
then?
question?
How much do I weigh now?
That you're
I
not
prefer that they don't know.
Well, okay. Do you mind if I know? I will not tell them. Well, can you just?
Better be quiet.
Approximately how long has that been?
I've gained like 5 pounds since April.
April of '79.
Right,
And you went in the hospital June of '78.
right.
You were in for 10 months.
Mm-hmm.
When you went into the hospital, what did you weigh? Do you remember? Approximately.
61.
So you
That's
went
my
from
low.
97 to 61.
Right.
61 pounds and 5 feet 2 inches. You're lucky to be alive. You must have been grotesquely thin.
Yeah.
Were you aware of how?
Yes, I was.
An anorexic may be literally starving, but starvation distorts perception. That's one of the side effects experienced by many who are afflicted with this condition.
When an anorexic looks in the mirror, she sees something completely different than a normal woman sees. She sees a body which she thinks ought to be thinner. And it doesn't matter if in the last 6 months at 16 years of age she has lost 55 pounds, which is an enormous amount of weight. She still sees herself as being too fat.
Camera lenses that distort images help in the study of bodily ideals. People who are particularly aware of fat problems and dieting are termed restricted. Now, if a restricted mother is shown a series of baby images, she is likely to choose as ideal one that's been made to look thin. She may want her own child to match this ideal thinness. But if the baby in the series is her own, the image she recognizes as her own child is usually one that's been made to look fat. If she has a daughter whom she sees as fatter than her ideal, that may be the beginnings of the pressures that can lead to a young girl's anorexia. One of the most dangerous manifestations of anorexia is an eating pattern called bulimia, first binging on rich food and then inducing vomiting to avoid any weight gain. This can so alter the balance of water and chemicals in the body that survival may depend on immediate treatment to restore the balance. A limited diet can also lower the levels of sex hormones in the body and suppress the menstrual cycle, a phenomenon found in anorexia, and in some female athletes. Athletic prowess means replacing fat with muscle. But in a woman, if the ratio of fat to muscle drops too low, so do hormone levels. Ovulation may cease. This can be a form of natural birth control for people who face seasonal food shortages. Babies are rarely born during the famine, when families must be on the move to find new food supplies. There seems to be a feedback mechanism that suppresses ovulation before fat reserves are used up, which might explain why in some communities most births occur at the same time of year, when food is seasonally abundant. Some anorexics also experience this early onset of menstrual suppression, perhaps a holdover from some ancestral need. Diane is 17. Just before she turned 16, she was found to be suffering from anorexia. It became serious enough to have her hospitalized. She and her parents decided on family therapy to try to discover and settle whatever it was that was driving her away from eating and towards a thinness that was endangering her health. Diane's family therapy was conducted by Libby Ridgely. A therapist's approach may occasionally seem harsh, but the aim is to provoke reactions that will replace obsessive dieting with a less harmful and more useful life strategy.
So how many pounds have you lost since you've been discharged from the hospital?
I was 114 when I left, and I'm 108 now, so I guess
6.
I guess that's 6, yeah.
That's getting very serious.
Yeah, I was kind of worried about it when I got home. I was kind of upset.
What are your thoughts about it?
Well, I'd like to see her get more, but Diane, it's up to Diane herself. She has to be her own judge, I think.
That's what I said.
Yeah, because
I'm going to have to gain it back this week, some way or another.
How is it that it gets up to Diane herself? I mean,
There are different family situations that can foster anorexic behavior. It may be a protest against overprotective parents, parents who avoid confrontations. The whole process of growing up and achieving independence requires some conflict. Refusing to eat can be a way of setting up the tensions that are missing. Emancipation through emaciation.
Always. So I guess this week it just hit me that she's right, and I got to start eating more, or I'm going to be in trouble.
what if Diane continues to blow it?
well, when she gets to a particular weight, then she would have to go back into the hospital.
And you won't move in before then?
Well, apart from forcing it down, which I don't think I could do.
Why?
I don't know. I don't know really, but I just don't think I could do that. Sure, I could tell her she should eat more.
Well, I guess it's me that gets more upset than her father. He can calmly walk away, whereas I can't.
He doesn't yell at me. He just tells me.
He doesn't yell at you.
No. He'll just say, in a calm, cool, smooth, collected way that bugs the crap out of me.
That bugs you?
It bugs me. I wish he'd scream. Why does he have to say, Diane? I think you should be cool. You know, like, you could scream at me, Dad. You know, I would be able to hear you better.
How much weight would you have to lose before your father would scream at you?
He wouldn't. He never has.
At 90 pounds? You think he might?
He never did. At 78 pounds, he never screamed at me.
This is a well-protected daughter. Maybe she doesn't need such protection.
Now, after 6 months of persistent therapy, Diane is well on the way to recovery. She has a boyfriend. She's preparing to go to university. She's found how to stop being dependent on her family and on her self-imposed starvation. For the overweight, the best advice is still get enough exercise and eat a balanced diet that's less than you're used to, and perhaps less than most of your friends eat. You can also try turning down the furnace and take the chance that brown fat might help burn the pounds away. But if you're not prepared to change your style of living, you may have to accept the way you are.